Well, good morning, everyone. I'm Mia McNeil. I'm the State Director for AARP Tennessee, and I am so happy that you have joined us for part two of our session dealing with implementing communication strategies for older adults in disasters. I heard that you had a fantastic session in session one, and so I know you're going to experience the same in session two. Um, you may have heard me say this before, but when we were having conversations about communicating with older Americans during disasters, we had no idea that we would actually have to deal with such a situation in Northeast Tennessee. And again, our thoughts and prayers continue to be with those individuals who were impacted by the hurricane. But it reiterated to us how important it is to have these discussions. So I am so excited that we have partnered with SBP, the experts in this area, to share information with you today. And hopefully you can take some of these nuggets back to your places of work, but also continue to exchange ideas with one another today. So with that, I will turn it over to our experts.
Thank you so much, Mia, for partnering with us, and thank you everyone who's joining us and those that continue to get on. A few quick notes. Please feel free to share your name and organization in the chat. We will have breakout sessions later on, but just a way for folks to start getting to know each other and who's in the room today. Really briefly, in case anyone couldn't join us for the first session, my name is Helen Wiley. I'm our Disaster Preparedness Program Director at SBP, and we're a national disaster resilience and recovery nonprofit that was originally founded after Hurricane Katrina down in St. Bernard Parish, Louisiana, as the St. Bernard Project. As we scaled and came to work nationally, we shortened our name to SBP. As you can see on this slide, we have a number of different programs and initiatives. Those of us on this call today work in our preparedness program, but we rebuild homes for low-income survivors. We share our practices with other organizations and small nonprofits across the country, and we have advisory and advocating services as we really work to scale best practices all across the disaster cycle to help high-risk populations. Next slide, please. And so really briefly, in the preparedness program, we worked with not only community leaders, but high-risk households to really empower them with important tools to more proactively prepare and build knowledge bases for proactive preparedness and resilience building measures. And so you can learn more about our program at our website. Next slide, please. And then importantly, we have a whole resource bank online of both preparedness and recovery resources that households can use as well as partners. And so we really encourage folks to check out our resource hub for different written guides. As we talk about in this presentation today, communication strategies with older adults. There'll be a number of things that my colleague Leanne references that are really important when we think about preparedness actions. And so encourage folks to check out our different guides and resources we have online. Next slide, please. And then also want to highlight that AARP created a great disaster resilience toolkit a few years back, and it's really aimed at practitioners, so both local government staff, local leaders, those that work in aging services, community advocates, and has lots of great case studies and tips and best practices to use with older adults. And so we'll reference a few of those in this presentation today, but really encourage folks to check out that great guidebook for good ideas of practices that can help older adults and reduce their disaster risks. Next slide, please. And with that, I'll turn it over to Tessa.
Thanks, Helen. My name is Tessa Barron. I am SVP's Disaster Preparedness Program Associate, and I'm just going to spend the next minute or two here recapping what we covered in session one, and then giving an overview of our objectives for the session today. So last time we spend some time talking about disaster risks and how those risks are increasing across the country. And specifically, really important for our conversation of increasing the preparedness of older adults, need to understand that older adult populations do experience high levels of disaster risk. So we started there to help do some ground setting. From there, we went into different tools that really do a great job of helping us do a couple things. The first is really get a strong understanding of what risks are most prominent in the areas that you serve, vulnerabilities, again, in your communities. And also, these tools help to identify those high risk older adult populations in your communities. And so those are the National Risk Index. That's a tool that's developed by FEMA. We also covered the Social Vulnerability Index, local disaster registries that may be available in your areas. And then lastly, we reviewed COINs, which are community outreach information networks. From there, we wrapped up the last session by talking about building relationships with trusted partner organizations in your communities. We talked about where to start, where to identify potential partners that you want to build relationships with. And then from there, what are actual practical steps for building and then maintaining those long-term partnerships. Next slide, please. So, building off of that, today we're going to be talking about how to actually build communication strategies that are geared for older adult populations that you serve. And so, we'll start out by first talking about how to tailor disaster risk communication. What are different formats? What type of language? What are different considerations that we want to be thinking about in order to make sure that our disaster risk messaging is appropriate and it's going to be effective and resonate with our target audience? From there, we'll shift gears to talking about, once we have the right messaging, what are the right channels that we want to utilize to make sure that it actually reaches our target audience of older adults? So we'll talk about different examples of different communication methods to think about. And then lastly, we'll wrap up today before our breakout session of talking about how to create disaster plans with a specific lens on older adults. So we'll have some specific guidance for older adult disaster plans. Next slide, please. And I will turn it back over to Helen to talk through our first section.
Yeah, thanks, Tessa. So we're going to start here on, again, Tessa just covered what we talked about in the part 1 of the series. Anyone that missed it, please feel free to reach out and we can share the recording with you. But we're going to talk a little bit now about tailoring disaster risk messaging. Next slide, please. And so there are a few things of why this matters. And I think it's pretty self-explanatory, but different populations have different needs when it comes to communication, and older adults are no exception. And so it's really critical that we take the time to tailor messaging to make sure it resonates with this target audience of older adults so that the message is stickier. And so one thing that we really encourage folks to check out, for instance, is NOAA, the National Oceanic and Atmospheric Administration, has some great resources in their Digital Coast Hub about more effective risk communication. And so they have all kinds of different templates that you can fill out that lead you through identifying the right messaging strategy, depending on if you're needing to do something more virtually or in person. And so want to do a call out quickly to that as it being a great resource to check out. Next slide, please. So again, when we're trying to think about tailoring messaging, there's a lot of different good questions to ask, and we'll be discussing this all more in the breakout. But I want to walk us through some different questions to frame up here. So, for instance, in your community, what are the types of barriers that you've seen that have kept older adults from receiving important information in the past? Was it that you were needing to rely on your, website or social media, and that just wasn't the mechanism that most older adults that your organization works with could really receive information well? Asking questions to identify the preferred communication method and therefore develop appropriate messaging. So, for example, are there more verbally based options that you can use for the demographic that you're working with? So really trying to get face to face, use word of mouth. Are there, churches and places of worship locally that a lot of older adults attend in your community that you can get in front of in a trusted environment to share different disaster messaging so that they're better able to prepare in the future? Do a lot of folks still get newspaper by mail or pick them up, at the local gas station? And so putting ads or information in the local newspaper. And then thinking about things too, like, the radio. And are there ads or particular stations where you could do a spotlight on importance of different preparedness tips? And then, again, other questions here. So, how can we develop an understanding of what organizations and individuals, older adults in your community trust to give information about healthcare and other health related issues? And so turning to those, again, thinking about, what then is culturally competent as like the right framing for people based on where they're going. And then learning like just currently where older adults in your community get their information about disasters. Are they turning more to local emergency management? Are they turning to their community centers? And so knowing where in the past, maybe doing a survey or just doing a small focus group of where people have gone before for information. And so then really leaning into positioning additional information with those sources or key location points. Next slide, please. So a few things here, and we've already talked to this a bit, but when we're tailoring messages to older adults across the board, so not just on disaster issues, it's important to think through a few things. So, and I'd say again, this works for broader populations as well, but using clear and precise messaging is really important. So, for the population at large, knowing again, if we can gear for lower reading levels, so that again, if people have language barriers and English isn't their native language, or any number of things, people now need bigger print sizes, that just by using clearer, more concise language, we're increasing access to important information and trying to reduce wordiness. When you look at different research, when you have a lot of clauses in a sentence, even that can be really hard for some people to really take in the information that's been shared. And so trying again to reduce language and wordiness in communications is important. Particularly when you have the opportunity, though, to share information more verbally, whether it's again in a church setting, community center, etc., trying to repeat information as much as possible. Again, not going overboard, but really repeating those key points that you're trying to hammer home, knowing that people may not always get the message the first time. And so that repetition is really helpful for hammering home key points that you're trying to get across to folks. And knowing again that, for specific disaster messages to hit home with someone, they might need to get the same information in multiple different modes of communication. And so using both a combination of written materials, so including like brochures or flyers, in a, preparedness presentation setting so that they have something written that they can follow along with while you're verbally sharing what to do and some steps to consider taking. But just really important again to think about using a combination of different methods when we're communicating with folks. Next slide, please. And so really quickly here, and then I'm going to turn it over to Tessa. But when we're thinking about communicating with those that have disabilities that are non-able bodied, again, there's a few different things that we can do to ensure greater access to information. One, it's really important when we're thinking about disaster messaging to ensure that people with disability have a seat at the table. And so again, if you're doing a focus group, making sure you're including a wide range of people in that focus group. So again, getting more people's knowledge of what does and doesn't work for them currently with different messaging or information that they're receiving. Work to remove any limitations to full participation for those that have disabilities. increase awareness with government actors on their needs. So if you work for an area center on aging and have greater knowledge of some of the functional challenges and needs of population in a particular community, what is the information that you can do and share back with local government authorities, particularly emergency management, so that they're better able to take action and respond if and when an event occurs. Last time we talked a lot about disaster registry, so doing what we can as well to help get more folks that are really vulnerable signed up for any existing local disaster registries so that first responders know where to go and prioritize. And a few ways that we can work to decrease impacts for those, again, traditionally those with disabilities are disproportionately impacted by disaster events. And so there's a few things that we can do to work to decrease impacts on them. And so really work to review, your current local emergency preparedness and disaster information for accessibility, and look, in any guides that are available or protocols for those gaps where more information needs to be added to ensure that those that are not able-bodied are able to be brought in. As well, when you're communicating with those that have disabilities, including text descriptions of photos and having the ability to resize text for individuals with visual disabilities. So if you are putting anything that's more virtually displayed, making it easier to increase the font size, or if you're printing out materials, just going ahead and having it be in a bigger font size to begin with. If you're doing any TV spots, PSAs, trying to include closed captioning and sign language interpretation for all emergency announcements, or if you're doing press conferences or releases, again, trying to increase accessibility post-disaster so that more folks are able to receive critical emergency information. And then finally, again, another way to decrease impacts is to ensure shelters are safe spaces, and also include support workers that can help evacuate specific clients that are having challenges. And with that, I'll turn it over to Tessa.
Great, thanks, Helen. So now we're going to shift gears and talk about how to actually communicate those tailored messagings with older adult populations. Next slide, please. So Helen just walked us through some specific examples of different ways that we can make sure that our messaging is tailored. The next step here, after we have that carefully crafted messaging, is to make sure that it's actually going to reach our intended audience. And so we have laid out here a couple examples categorized into verbal options and written options, but really there are two main takeaway points here. And the first is that we want to make sure that we're using an approach that has multiple different options. So if you're going to use verbal options like TV announcements or radio ads, make sure to supplement that with some written options as well. So we'll walk through some of those in a moment here. But the idea here is to have a multi-pronged approach. If you really want to reach all the individuals in the community that you serve, definitely need to consider multiple modes of communication. And so this is not an exhaustive list by any means, but here are some popular examples of starting points of things to consider. Other thing to emphasize here is that this is, of course, going to be unique and dependent upon the characteristics of your specific community. So maybe, for example, you live in an area that has a really strong faith-based presence. And so in that case, you might want to consider leaning heavily on faith-based leaders, church pastors, as trusted community leaders that can help spread that information to folks far and wide. Other options to consider, word of mouth, phone calls, things of that nature. When it comes to written options, this is not just digital, although we will certainly cover that, but things along the lines of newspaper ads, brochures. Personal example, before coming to SBP, I worked for the South Carolina Office of Resilience, and we did a lot of community engagement and public outreach, specifically to very rural, small towns throughout the state. And so we always did bill inserts. That was one surefire way that we knew that whatever the messaging was that we wanted to share out with folks, it was mainly an older adult population, but there was a spread, that was the way to reach individuals. So there are a lot of different ways to get creative with communication methods. Other things include website updates. If you know that your website gets a lot of traffic and that a lot of people are going to see what's posted on there. And then, of course, social media posts, text messaging, those more digital options. Next slide, please. And so, again, main point here is that an important part of communicating with older adults is knowing which ones of these channels are going to be the most effective. And so for older adult populations, important to emphasize here that broadband access, so internet access, may be available. But if we're talking about an older adult population, mass media usage may be limited. And so completely fine if you're going to use some mass media to communicate with individuals, but just want to make sure that that's just one of many methods that that you use. And so we wanted to take a moment to share out this tool here, and we'll follow up with resources afterwards so you have that. But this is a really helpful interactive national broadband map, and this is owned by the Federal Communications Commission. And this is, again, a helpful tool that'll help you understand variation of internet access throughout the country. And so you can use this to see what areas, what populations, communities in the areas that you serve have strong broadband internet access. But again, understanding that just because they have that type of access, they can get online, doesn't mean that they are. And so again, using digital is great as long as it's supplemented with different options. Next slide, please. Our next suggestion here is really to build relationships with your intended audience. And so, of course, we're talking about older adult populations in this series. This is also for in-person opportunities. And we want to suggest that you find where your audience congregates. Know what those local areas are, events, hotspots that folks gather that you can go to, because those are going to be really great opportunities to meet folks in person and to start building relationships. You can have informal conversations and again start building relationships with folks and start making connections. But also there are opportunities to speak to event organizers, whatever that event might be that's popular in your community, and see if you can build in a formal opportunity to share out and to communicate your desired messages. So some examples are town council meetings, homeowners associations. We talked about faith-based groups, and if that's something that's popular in your community, and also farmers markets, great informal way that the community gathers and that you can have nice conversations with folks and share out disaster risk messaging. Next slide, please. When you do have the opportunity to engage and have conversations with your intended audience, we want to make this process as participatory as possible. Risk communication is a continuous process, not a one-time ordeal. And so making sure that it's engaging and interactive is really going to be a good way to encourage continued involvement. This is also going to be the opportunity to encourage feedback from folks, so that way this process of how you're communicating with individuals, whatever your communication strategy is, it can continuously be shaped so it can be effective. Just have some options here, but again, not an exhaustive list, starting point of different ways to make in-person engagement experiences more engaging. And so this could include things like small groups, breaking apart the audience into smaller groups like we're going to do today. If you have a large group that's in attendance, Q&A sessions, so folks are able to in person live get their questions answered, tabletop exercises, even a comment box that people can write responses in and submit on their way out, or a survey, a virtual or a written survey. Both great options, but great to have both to be accessible. And then lastly here, wrapping up with a case study. And this is a case study that was from 2016. And, we see here that in 2016, Los Angeles, both the city and the county, had partnered with AARP California to develop an initiative called the Purposeful Aging Los Angeles Initiative. And the entire point of this project was to engage older adults throughout the county in all county and city planning processes, emergency response protocols, drills, and again, and just all planning. This here we wanted to share out of less of an example of specific communication strategies, but more so because it takes a look at a comprehensive planning project that was so effective because it included those that it was trying to serve. So older adults, of course. We like this example here because it includes, a lot of great options that older adults would find useful in disasters. So it enabled older adults to get registered in mass notification systems, tailored emergency plans throughout the neighborhood to meet specific older adult needs, and even help to work with households to develop age-appropriate family emergency plans and provide preparedness kits for those in the community that are most in need of them. And so again, great example, because while we're taking a look specifically at older adult communication strategies, the end goal of this entire session is to increase the preparedness and the resilience of older adults in the face of future disasters, and involving older adults in the planning processes is certainly one way that we're going to make sure that their needs are specifically met. Next slide, please.
Thank you, Tessa. So I'm Leanne Ortiz, SVP's Community Preparedness Engagement Manager. In this section, we're going to be exploring a little bit more about how you can assist older adults, community members, or even your own household with creating disaster plans. So creating a disaster plan can seem a little bit daunting at first, but we're going to break it down into 3 achievable steps. First, we're going to focus on putting together your supply kit, specifically highlighting items to consider for older adults that folks might not be thinking about. Next, we'll cover creating your emergency plan and where to start. And finally, we'll discuss making a recovery plan, which is often overlooked, but just as important to make sure that folks can recover quicker. So when gathering emergency supplies, it's essential to ensure that most important items are easily accessible, because we know that disasters are not always going to give us a heads up. So more often than not, these necessary supplies are already in our home, but they're probably scattered in different places. So we want to work on putting them all in a place that we can easily grab them, maybe in a book bag, or all together, or just know that, for example, for some other items that we're going to mention later, that we always know where they are. So that can look like always putting that item in the same place. So when we're in a rush, we know that we can go grab it from there. So standard items include, as we know, non-perishable food and bottled water, making sure it's easy to prepare, making sure to have a gallon per water per day, having your flashlights, extra batteries, extra clothing, and copies of your emergency contacts. However, when we're talking about preparing older adults, additional considerations are really important. So this includes having additional medications, or at least knowing what those medications are. So that can look like having a printed list of your current medications and doses, who's the doctor providing them, which one is your pharmacy, where do you get that from? Having your ID band or a copy of it with life-saving information, having necessary gear such as hearing aids and the extra batteries, your glasses, contact glasses. And very important too, it could be having a list of the model and vendor details for medical equipment, such as an oxygen tank, a wheelchair, or walker, just in case it needs to be replaced, and make the process a little bit easier for folks. When we're creating a disaster plan, it's very important to understand that by having it in place, it can help reduce risk and also ensure the safety of others during an emergency. So a good place to start for this is by checking and refreshing your emergency supplies, those that we just discussed, annually, or choosing a trusted individual to be the main contact during a disaster, or acting as one for someone else. Folks can set up a checking system with neighbors to support each other and sign up for local registries, similar to those that Helen mentioned. Folks are already talking with neighbors, especially amongst older adults. Why not make sure that they're also checking in when it's most needed and having that structure and network in place? For example, folks can register to Smart 911 or Code Red, who will give alerts if there's anything happening in the area, but also it will provide life-saving information to first responders if the call comes from that number. If folks are in a retirement home or assisted living facility, it's very important for them to understand what the emergency plan looks like, and also to encourage family members to understand what the plan of that family member is where they live. Those with medical or transportation needs can also register for any local disaster assistance registries to help with that evacuation as well, or whichever needs that they might have in the moment. Lastly, it's very important in your roles to encourage folks to practice evacuating their home. So that can mean like, hey, I'm going to go grab my kit, grab my walker, and then walk out the home and see how long it's taking me. See if I need to move my bag and maybe put it in the front closet. What does that look like for folks? Have people identify nearby shelters. If they have a pet, make sure that that shelter accepts their pet, and have them share plans with loved ones. It's very important for us to share out as a family, as friends, like, hey, this is my plan. Am I a part of your plan? Let me know so I can also alter my plan. We know that those with a well-structured recovery plan tend to recover faster, and it's important to remember that disaster aid isn't always guaranteed, which is always a stark reminder of why we need a recovery plan in the first place. A good starting point for everyone is to create a home inventory with photos and videos, and to organize important documents in secure places. It could be the cloud, it could be a fire waterproof box, it could be with a trusted person outside of town, it could be with a lawyer, or it could be all of the above. These quick actions will help people avoid paperwork delays when they're filing an insurance claim or requesting disaster aid. As you're able, encourage individuals to set aside savings, whether it be for insurance deductible or an unexpected cost. They do add up really quickly, and sometimes we just need to have that extra fund on the side so it doesn't take us by surprise when we do need them. Because sometimes we have to pay for debris removal, temporary housing, fuel for your generator, additional food. And I know shifting the budget is not necessarily possible for everyone, but putting this in the forefront for folks and help them think about like, hey, I have an extra $20 this week, let me put it aside. And at first you might think it's not much, but having that mentality, little by little, it will become a good size fund for folks to use for the deductibles or just unexpected costs. While people are doing it, is a great time to have folks review their homeowners and renters insurance. Look at their coverage, look at their deductible, see if there's any needs, anything that needs to be changed. And it's also important for folks to consider if it's time to purchase flood insurance or if they need any additional coverage. This could be a helpful resource to provide in your community. So it could be like hosting a workshop for folks or having a resource come out to help explain insurance terms or look over people's policy so they can understand what type of coverage they have. Ultimately, like everything else, it's a process that becomes so much more easier when they have the support of family, of friends, trusted community members like you all to guide and help them in this process. And again, as community leaders and service providers, your trust and knowledge are essential in keeping your community prepared. One key action is to educate and raise awareness about the importance of staying prepared. We briefly covered how to create a disaster plan, but it's important to encourage individuals to review and practice their plans annually. Or if not, when there's a major change in the household, it could look like moving locations and new family members in the house. So it's a good reminder of like, hey, this changed. Let me practice, let me review my plan. When we're helping people create plans, remind them to consider a range of potential events beyond hurricanes, tornadoes, and floods. We see that disasters are increasing. Sometimes it's happened that, hey, maybe for decades this hasn't happened in our area, so we're not necessarily thinking about that happening. We're also noticing that power outages are becoming more frequent, and we know how bad that could be for an older adult to not have access to be able to use their equipment, or just to, if it's the summer, the possibility of a lot of heat, all of those things. And we also know that house and wildfires can destroy years of hard work in an instant, and oftentimes we don't think about that being something that we need to prepare for. Finally, I ask everyone to leverage your community connections to help engage older adults and others in disaster preparedness. This can involve partnering with local churches or food pantries to create a space where you can put when folks can put together a preparedness kit for zero or to no cost. or just a low cost, maybe having the pantry provide some of those items. To learn about insurance coverage, like I mentioned earlier, to learn about the risk in the area. Maybe there's folks who are new to the area or haven't been too aware of things happening nearby, or what mitigation actions they can take to against those risks that they just learned about. And lastly, you can do a sign up drive for local older adult registry so they can be thought about when disasters happen. Lastly, by offering these accessible workshops and resource support, folks can know what is available to them, and it can also make disaster planning more inclusive and effective for everyone involved in the process. Thank you. I'll hand it over to Helen.
Thanks so much, Leanne. We can go to the next slide. Next slide, thank you. So we really hope everyone will stick around for the breakout session here. It's a great time for people to connect across the state, to share more of what is and isn't working with communication strategies you're seeking to use. And so really quick here, instructions wise, we're going to spend about 15 minutes actually in breakout groups. We'll break into 3 breakout groups, and your moderator in your room will go through the different instructions, but we'll have everyone share their name and affiliation, and we'll designate again someone from each group to serve as a group speaker who will report back some top discussion points when we do a report out following the 15-minute session. Next slide, please. And so again, the facilitator will go over these questions, but really just to get us started, we're going to start by discussing what types of communication challenges your organizations have used in the past and how have they been successful. And then based on best practices that were shared during this session and last session, how can your organization modify any existing messaging so that it better meets the needs of its older adult populations? And we have 2 additional questions and we'll hopefully get to them. But with that, Tessa's going to go ahead and move us all into breakout groups. And so everyone will see a prompt very shortly to move into a room. But while we wait for that, I'll go ahead and just say the last question or 2. So again, if folks have time in the rooms, are there any existing opportunities in your community to get connected to older adult individuals? And how can your organization best support older adults in your network with creating disaster plans? Okay.
We should have everyone back from their breakout rooms, but as folks continue to join, we're going to go around and do just a quick report out of top things that were talked about across the different questions, or just the questions that each of the groups got to. So why don't we go ahead and start? I'm not going to go in order. We'll start with the group that I was leading. And Robert, if you're wanting to share out anything, please feel free.
Yeah, absolutely. We had actually a great discussion, and we really just admittedly covered just 2 of the questions. So I'll just kind of walk through that real quick. There was the first one about what communications channels we've used in order to communicate with older populations, and it's a pretty good variety. Social media, we've at AARP, I'm with AARP, and we've done blog posts on our website. We've used text messaging. I think the biggest one, though, is probably phone. Everyone in our group has used phone in some capacity. AARP does a dial out to members to share information. And Jim shared that they have a hotline number where they've got 10 staff who can receive calls and provide information to folks who are facing either direct issues around natural disasters or what have you. So those are the biggest ones. And then the last question was, how can we best support older populations in creating a disaster plan? We talked about a virtual event or a webinar to help walk through and actually build a plan. We could certainly put something on the website, like a step-by-step guide on how to do that. And then there's also, don't forget about creating print materials and pamphlets and things like that really have that permanence and folks can have in their hands. There's something to be said still for folks wanting to actually have something physical, either to put on the fridge or in the drawer and be able to reference that. So those are the things we came up with to kind of help support folks.
Thanks so much, Robert. And yeah, we had a great discussion. If we could then go to Helen's group, whoever the speaker was in that, and for the sake of time, if you could just take about 1 minute and walk through top points from your discussion, that would be great.
Definitely, you got it. So yeah, communication channels, we mentioned flyers, tabling events, and outreach calls, as you mentioned, Robert. But again, depending on the region, because different regions respond differently to different outreaches. And then the second question, because we're able to get through all of them, we were mentioning maybe we shouldn't perhaps modify what we were sharing out, but the how we're sharing the information, because as we mentioned, everybody needs to know what to do all the time. So we can't cut off certain information, and keeping in mind the population that we're trying to reach. So that could be Facebook and radio ads, but again, still working on that. And then lastly, sorry, I'm going a little bit quick here. The existing opportunities, we mentioned meals, one-on-ones to give out information, flyers with that as well. Channel 5 Connect was mentioned, and then the shorter format content. Yeah, as well as in-person activities and sharing examples through Facebook.
Thanks, Lucida. I really appreciate it. And then lastly, if we could jump to Leanne's group to share out just a minute of top points from your group discussion.
For my group, Paul will be sharing.
Oh, thank you. I volunteered at the last second. So yeah, what communication channels we discussed, I think we all agree that the live channel, live presentations, meeting people face to face is the most effective as far as building trust and bringing in people, even if it's not the person who needs our services. We get a lot of, I know somebody who could really use you, and then they'll connect us to them. As far as revising our channels of communications, we discussed reaching out to alternate locations such as like grocery stores, home improvement stores, especially after a disaster. They had a lot of foot traffic, and setting up there and reaching out to the public there. Again, it may not be the senior, but it may be somebody who knows that senior that can direct them to us.
Thanks, Paul. Appreciate you jumping in last minute to be the speaker for your group. We will go ahead and go into our wrap up now, and apologies that we're just about at time. So we will be sharing our email address. If folks have questions, you're more than welcome to reach out after the fact, and we're happy to answer any questions you have. But if we go to the next slide, please, as we go ahead and wrap up here. Next slide, please. Well, and just as we're wrapping up, we have, oh, thank you. Next slide again, please. Great, thanks. So we just have a couple of resources that we're sharing out on SVP's end. In our resource hub, we have a plethora of information from recovery, preparedness, recovery, resilience across the full disaster cycle that we definitely encourage folks to check out. And so the website address is there, and we'll be sharing that out afterwards. Next slide, please. And then again, AARP's Disaster Resilience Toolkit is a really great resource to have in your back pocket. A lot of key studies and examples of different things that, that folks can consider adapting or just transferring to their community to continue to build towards more resilient communities. So a really great one to have on hand that we want to make sure folks are aware of. And that's in the chat as well. Next slide, please. And I know we have some folks joining across different states, but for some Tennessee specific resources, we have a couple listed out here. And you know, we'll be sending these out after the fact. So I'm going to breeze through it pretty quickly, but Tennessee has a lot of great resources we want to make sure folks are aware of and have top of mind for how to increase preparedness for all individuals, but especially older adults, of course, given that focus for our session today. Next slide, please. And then lastly, we have a brief 1-minute survey. If folks wouldn't mind just taking a moment to fill that out, we really appreciate any feedback that anyone's willing to share. It helps us continue to shape our sessions and make them more engaging and beneficial. So if you wouldn't mind taking a moment, the QR code's on the screen, but it's also in the chat as well. Next slide, please. All right, so we're wrapping up. I will pass it back over to Mia, but thank you all again for participating. We really appreciate the engagement and the breakout discussions. And yeah, thank you from SVP's and back to you, Mia.
Awesome. Thank you, Tessa. First, thank you so much to SBP for working so diligently to put together this wonderful two-part series. It is my hope that you've been able to take some really wonderful information from this such that we can be our best to our best to older Americans in our communities to make sure that they have the needed information in order to be prepared for disasters going forward. Please always use AARP as a resource. We have regional representatives in each one of the grand divisions, and we'd be happy to assist where we can. Please let us be a resource to you. But again, thank you so much for your participation today, and we look forward to working with you going forward. Have a wonderful rest of the week and a fabulous holiday season, and we'll see you in 2025. Bye-bye.